Lower limb multiple choice questions part 2. Question number 1. The line of firm attachment where the membranous layer of superficial fascia firmly attached with deep fascia of the thigh is called option A. Langer's line, option B. Holden's line, option C. Shenton's line, option D. Intertrochanteric line. The answer is option B. Holden's line. Question number 2. Which one of the following is preventing extravasate urine into the thigh? Option A. Langer's line, option B. Holden's line, option C. Intertrochanteric line, option D. Shenton's line. The answer is option B. Holden's line. Question number 3. The length of Holden's line is about option A. 1 cm, option B. 5 cm, option C. 8 cm, option D. 12 cm. The answer is option C. 8 cm. Question number 4. The root value of saphenous nerve is option A. L1 and L2, option B. L3 and L4, option C. L2 and L3, option D. L2, L3 and L4. The answer is option B. L3 and L4. Question number 5. Which of the following structures drained by upper medial group of superficial inguinal lymph nodes? Option A. Terminal part of urethra, option B. Anal canal, option C. Vagina, option D. All of the above. The answer is option D. All of the above. Question number 6. All are modifications of fascia lata or dysphagia of the thigh except option A. Intermuscular septum, option B. Saphenous opening, option C. Iliotibial tract, option D. All of the above. The answer is option D. All of the above. Question number 7. Which of the following muscles inserted into the iliotibial tract? Option A. Gluteus minimus and gluteus maximus. Option B. Tensor fasciae latae and gluteus medius. Option C. Tensor fasciae latae and gluteus minimus. Option D. Tensor fasciae latae and gluteus maximus. The answer is option D. Tensor fasciae latae and gluteus maximus. Question number 8. Which of the following arteries not a branch of profunda femoris artery? Option A. Medial circumflex femoral artery, option B. Deep external pudendal artery, option C. Lateral circumflex femoral artery, option D. Perforating arteries. The answer is option B. Deep external pudendal artery. Question number 9. Which one of the following arteries is passing between anterior and posterior divisions of femoral nerve? Option A. Medial circumflex femoral artery, option B. Superficial external iliac artery, option C. Lateral circumflex femoral artery, option D. Deep external pudendal artery. The answer is option C. Lateral circumflex femoral artery. Question number 10. Which one of the following arteries passing between the pectineus and the psoas major muscle? Option A. Medial circumflex femoral artery, option B. Superficial external iliac artery, option C. Lateral circumflex femoral artery, option D. Deep external pudendal artery. The answer is option A. Medial circumflex femoral artery. Question number 11. The root value of femoral nerve is option A. Dorsal divisions of anterior primary rami of spinal nerves L2, L3 and L4, option B. Dorsal divisions of anterior primary rami of spinal nerves L1, L2 and L3, option C. Ventral divisions of anterior primary rami of spinal nerves L2, L3 and L4, option D. Dorsal divisions of anterior primary rami of spinal nerves L1, L2 and L3. The answer is option A. Dorsal divisions of anterior primary rami of spinal nerves L2, L3 and L4. Question number 12. Which one of the following muscles is not supplied by posterior divisions of the femoral nerve? Option A. Rectus femoris, option B. Vastus intermedius, option C. vastus lateralis. Option D, sartorius. The answer is option D, sartorius. Question number 13. The longest muscle of the human body is option A, rectus femoris. Option B, flexor digitorum longus. Option C, peroneus longus. Option D, sartorius. The answer is option D, sartorius. Question number 14. The muscle pulls the synovial membrane of knee joint upwards during extension. Option A, rectus femoris. Option B, articularis genu. Option C, vastus medialis. Option D, sartorius. The answer is option B, articularis genu. Question number 15. The structure stabilizes the knee joint both in extension and in partial flexion. Option A, rectus femoris. Option B, iliotibial tract. Option C, vastus medialis. Option D, sartorius. The answer is option B, iliotibial tract. Question number 16. All of the following muscles present in the floor of the femoral triangle except option A, adductor magnus. Option B, pectineus. Option C, adductor longus. Option D, iliacus. The answer is option A, adductor magnus. Question number 17. The medial compartment of femoral sheath is option A, Hunter's canal. Option B, femoral canal. Option C, adductor canal. Option D, inguinal canal. The answer is option B, femoral canal. Question number 18. The medial boundary of femoral ring is formed by option A, lacunar ligament. Option B, iliofemoral ligament. Option C, pectineal ligament. Option D, reflected part of inguinal ligament. The answer is option A, lacunar ligament. Question number 19. The femoral canal contains option A, lymph node of Cloquet or Rosenmuller. Option B, lymphatics. Option C, areolar tissue. Option D, all of the above. The answer is option D, all of the above. Question number 20. The subsartorial plexus of nerves formed by branches from option A, medial cutaneous nerve of thigh. Option B, saphenous nerve. Option C, anterior division of obturator nerve. Option D, all of the above. The answer is option D, all of the above.